Good afternoon. Today I want to talk about a group of healthcare professionals whose work touches the lives of Albertans every single day, often without people realizing it. Public health inspectors help ensure the food we eat is safe, the water we drink is clean, and the public spaces we share meet important health and safety standards. Alongside researchers and health promotion facilitators, they play a critical role in protecting the health of our communities and preventing illness before it happens. They have joined us here today to highlight just how important this issue is. These are highly trained professionals who carry enormous responsibility. They deserve respect, stability, and fairness. Instead, they are being presented with an unacceptable choice: accept less or leave their jobs. Under the government's healthcare restructuring, approximately 370 of our public health professionals will be transferred from Alberta Health Services to direct government employment, and therefore change union representation from HSAA to AUPE. In recent transfers within healthcare, workers maintain their wages, benefits, seniority, and other negotiated rights. But based on information released this week by AUPE, the union negotiating this transition agreement, the government has rejected key proposals that would keep our members whole. That means workers who negotiated a fair collective agreement just 6 months ago could lose negotiated wage increases and other important protections. These workers are not asking for special treatment. They are simply asking for the rights, wages, benefits, and protections they have already earned and negotiated be respected. No one should be forced to choose between accepting less and leaving their career. I do want to acknowledge AUPE, which is negotiating the transition on behalf of these workers. While these professionals are currently represented by HSAA and are expected to become AUPE members through this transition, both unions are united on a simple principle: workers should not lose because of a decision by the government. We appreciate AUPE's efforts to advocate for these members and to secure a fair transition. This is not about one union or another. It is about treating healthcare professionals fairly and ensuring public health services remain strong. This situation is bigger than the impact on workers. When government creates uncertainty around employment, compensation, work locations, and classifications, it risks disrupting an experienced workforce that Albertans depend on. Public health services protect communities. They help prevent outbreaks, respond to emerging risks, and keep people safe. Stability matters. And that is why HSAA is calling on the Government of Alberta to immediately guarantee that these workers will experience no loss of negotiated wages, benefits, or pension entitlements, that their seniority, years of service, and vacation entitlements will be fully recognized, that they receive clarity on transition timelines, classifications, and employment terms, and that they have stable employment in their current communities and work locations. Most importantly, we are calling for a fair transition that keeps workers whole and protects the public health services Albertans rely on. HSAA stands with our members. We remain committed to working constructively with both the government and AUPE to achieve a fair outcome. The government still has time to get this right, and we urge them to do so. Thank you.